Good day everyone, my name is Denelle Morais and I'm the Marketing Manager at Bestmed. We welcome you to today's talk about the role of physiotherapy in pain management. I'm joined by Annelie from Heerden. Annelie, would you mind introducing yourself?
Good morning, Denelle. My name is Annelie. I'm a physiotherapist and I'm specialized in neuromusculoskeletal and pain management.
So what I understand about the concept of physiotherapy is that treatment varies dependent on the condition. Is that correct?
You are correct, Denelle. We, as physiotherapists, treat a variety of conditions. So we have patient treatment for people with respiratory conditions, and then we also have rehabilitation for people with neurological conditions like strokes, traumatic brain injuries, children with cerebral palsy, and then we have the field of musculoskeletal therapy. So I'm a musculoskeletal therapist and we specialize in helping people who suffer with pain. And our role is really to determine why they have pain and then to address that with good pain management, and then from there to help them recover to the place where they can function to the level that they did before.
So in a physio session, Annelie, what can I expect?
Denelle, I think the first thing to mention that's important is that when you have an acute injury, so you have moderate to severe pain, that it is important that you go and see a physiotherapist. So that if your condition doesn't clear up within a few days, that you get the help that you need. In the session, you would have an assessment, and then from there, we would do joint mobilizations, massage, and very importantly, exercises to help you get better so that you can get back to what you did before.
So Annelie, I know that there has been an increase in chronic pain, and so the management of chronic pain has become more important. What is your view on that?
Denelle, you're very right in terms of that. There's a lot more people who are suffering with chronic pain nowadays. And when it comes to chronic pain, it is very different to acute pain, not only because of the duration of symptoms, but because of the mechanism behind the reason of chronic pain. When it comes to chronic pain, it's a lot more about the sensitivity of the nervous system and less about what's going on in the structures of the body.
That's very interesting context, Annelie. Thank you. I want to understand more about the concept of pain management theory. But first, can you explain what you mean by the sensitivity of the nervous system?
When I talk about the sensitivity of the nervous system, it's got to do with what happens when we have an injury. So an injury and pain is not the same thing. In our bodies, we have specialized nerve endings. We can talk about them as the danger receptors. And they respond to threat, so potential or actual tissue damage. And message will go through to the brain will interpret the message and say, oh, we need to protect. And the outcome of that will be that we will feel pain. So the pain will motivate us to stop doing what we are doing, to change position in order to stop us from hurting ourselves and getting actual tissue damage. Now, with acute pain and an acute condition and an injury, we most probably have an injury and tissue damage in the area. And then as we get better over a period of time, as the tissues heal, the pain levels will also get less, and at the end we will not feel pain anymore. But with chronic pain, what happens is that somewhere along the line with the messages going through to the brain, that it got stuck, and that the messages still continue even when there's been healing in the area. So when we have chronic pain, it's got to do more with the nervous system that keeps on producing messages of threat, and not so much to say that there's still an injury in our tissues. The more the brain gets the messages, the better it gets at receiving the messages, and the more it responds to it. So it becomes more sensitive and more sensitive. And eventually the brain starts responding even when there are other things that could be causing threat, then it will give us pain. So if you didn't sleep well, or if you have more stress, and even negative thoughts or emotions can make your pain worse.
I've seen a trend on social media where people show off their braces working on their Instagram smile. Is there a rise or prevalence in the types of injuries you're treating?
Denelle, yes, we've definitely seen more people with chronic pain, and a lot of it we can contribute to COVID-19 and what happened in that time. So first of all, a lot of people who got COVID ended up having long COVID, and long COVID symptoms include pain, fatigue, and these patients do need specialized care still. Then we have, as another reason, people who had injuries prior to COVID but never had it seen to, and due to the mismanagement during COVID, it also ended up becoming more of a chronic pain problem. And the third reason, I think, is a lot of people during COVID experienced a lot of pressure on them. Longer hours at work, working from home, not having the correct chair that they sat in at home. And then while working from home, also dealing with children, dealing with social isolation, dealing with the emotional and psychological factors of COVID.
Given what we've learned about pain processing and the fact that we want to prevent it from having a negative impact on our quality of life, what is a holistic approach when it comes to physiotherapy?
Denelle, I think it's important to realize that when it comes to pain, everything matters. Pain gets produced by the brain. So it doesn't only respond to the physical threat, but to any psychological and social threat that could be playing a role as well. And that will also make the pain system more sensitized. So when we address patients with chronic pain, and when we talk about a holistic approach, we talk about addressing factors like stress, like sleep, hygiene and sleep management and education, and also helping our patients to gradually get better by moving, by planning how much they have to do through goal setting and also through pacing.
Can a physiotherapist address all these problems, or are there other disciplines that can contribute to the holistic approach?
Denelle, it's been shown that the more people you have on your team, the better. So a pain-informed multidisciplinary team can consist of a physio, occupational therapist, a GP that prescribes the correct medicine, and also a psychologist.
I think the beauty of interviews like this is the opportunity to hear from an expert physio who has such an intimate knowledge of pain management. So if I had to summarize what you said, is that pain management requires a truly holistic approach and that acute and chronic pain require different approaches. Is that correct?
Yes, Denelle, you are so right. I think we underestimate how chronic pain really causes a lot of suffering for people who live with that. But there's hope for them, because with the right management and with tools, they can gradually get back to having a life of quality.
Thank you so much, Annelie. It was such a pleasure spending time with you and hearing about the expertise in the field of physiotherapy.
Thanks for the invite, Denelle. I really enjoyed it.